views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.
Good day. You are listening to Ability Radio. I'm Amelia Headly-LaMont, one of the co-hosts of the Disability Rights Center of the Virgin Islands. And today I am so happy to be joined by my friend and colleague, Archie Jennings. He is the...
Good morning, Amelia.
How you doing?
Good.
I wanted to let our audience know, as if they didn't know, a lot of people know Archie Jennings is the Director of Advocacy and Assistant to the Executive Director of the Disability Rights Center of the Virgin Islands. Thank you for joining us today. I'm so happy to have you.
Thank you for inviting me. Got a lot of good news for the community, hopefully.
We could use some good news, that's for sure.
Right. That's true.
Well, one of the things that we were going to talk about, and there's a variety of things, and one of the topics that has been of interest in our community is a variety. One having to do with, of course, the Americans with Disabilities Act, a new law that's in place possibly for the Virgin Islands, referred to as the ABLE Act. Next month is Mental Health Awareness Month. So how should we tackle this? What do you think?
Well, again, a new law that gives relief to a lot of parents with children with disabilities and persons with disabilities can take advantage of is what we are focusing on a little bit. It's called Achieving a Better Life Experience Act. That's the acronym for ABLE. And it's meant to help to establish a savings account program for individuals with disabilities. So it could be for a person with a disability, or someone who's a designated beneficiary of such account, or they could be the owners of the account themselves. And it helps in the overall, we all are facing this high expense of medical needs.
Right.
So regardless of your race, gender, nationality, station of life, with the ABLE Act, you can open a savings and investment account to assist that person to meet their medical needs and other needs that are qualified under the Act. So there is in 2014, the federal Congress passed the ABLE Act, and each jurisdiction can join in on the coverage and the ability to open such account. And Virgin Islands now has it pending before the legislature and senators. So those who are interested in this aspect, dealing with the high costs and expenses of medical, durable equipment, medical needs, should pay close attention and get to your senator and make sure they pass such an act for the Virgin Islands.
That would be excellent, because this would allow a family member to put money into an account without a tax consequences. Am I correct in that?
Correct. Well, of course, once this act is put in place, has to follow what the federal law allows, and then they can, expand upon it and customize it for the Virgin Islands. But it's to enable them to save money for qualified disability expenses without affecting any of their eligible other government benefits. Because as you know, like for Medicaid, if you, of course, no matter what the income, they have to have income eligibility. But if you had a house, I was in Ohio when the law first passed, and of course, being one of those legal aid attorneys who were helping people transfer property so they could become eligible for Medicaid.
Right.
But you had to do it before a 2-year period of time, or had to wait 2 years to become eligible. So now with this ABLE Act in place and savings account, the person can not only open an account, people can donate to their account, and it'd be tax free for the recipient. But the other person on the other side can take it off as a deduction, or if a charitable organization, they could take it off as charitable contribution. So there's aspects of it that needs to be flushed out with the Virgin Islands Act, but essentially it will help parents and relatives. And as we get to our age where we may need assistance with Social Security and Medicare and Medicaid,
Hmm.
it will help all age groups, meet those medical durable equipment needs
Right.
or expenses.
And ABLE stands for, what was the acronym standing for again?
Oh,
Ability.
you're testing my memory here.
Yeah.
Achieving a better life experience.
Okay. I'm going to write that down.
Achieving a better life experience.
Okay.
Achieving a better life experience. ABLE.
That's excellent. Thank you for that. And,
So,
as it evolves, an individual can call the Disability Rights Center for more clarification and just to get an update, correct?
correct. But first, they should be out there pushing to make sure it gets passed.
Right.
It's going to be before the legislature. Mr. Drago, who's the executive director
Mm-hmm.
of Disability Rights Center, is lending some testimony to the passage, and hopefully it's happening this week. But look for it, call your senators about it, make sure that the community knows this is how you get things that are good for your community, that are good for those who are suffering under these circumstances. Because again, one of the worst things ever happened to the Virgin Islands is left out of the Medicaid, left out of supplemental security income, SSI,
Right.
because that would have made sure that persons with disabilities or elderly had a lifetime income and could have, and also be eligible for Medicaid. But Virgin Islands was not included, and of course, I applaud you to this very day. Anytime it comes up, I bring out shadow citizens that said, Amelia, push to get all this information out there. You just got to get more people using that information to keep lobbying for SSI coverage for the Virgin Islands. Little was it known at that time of a major group that would appreciate it is those children that have severe autism
Mm-hmm.
along the autistic spectrum. But, early 70s, autism was not on the radar.
Right.
So they actually had passed the bill before the issue had come up. But it seems to be growing larger and larger as far as the pool of those who are identified as having severe or autism along the spectrum.
Mm-hmm.
It's just a matter of, how severe it is. But it's costly for those parents who might have to pull out of their pocket. It's a very costly expense.
Right. Well, for anyone who has a severe health need, it's costly, period.
Right.
Yeah, medical needs are, sad to say, a very expensive undertaking, here in our community and throughout, the United States medical system.
Throughout
That's for
the nation.
sure. That's a given. Next month is Mental Health Awareness Month, and you had some positive news on that front as well. The month of May, yes.
Right. We are always saying that the psychological board of the Virgin Islands has been created by the legislature, and they now have a certified board to oversee psychological services here in the Virgin Islands, which did not really exist before. So it's an independent board. I've been in contact with Ramona Moss, who's the president of the board, and they are taking up their responsibilities very seriously. And it's a good way for consumers to be assured that anybody that advertises themselves as psychologists or therapists, that have the wherewithal to make sure they're licensed
Right.
through consumer licensing here, and then that the psychological board will make sure that they are experienced or have the skills to so advertise themselves. So they have to register with this board. So a lot of the rules and regulations are underpinning this psychology board that's being worked on at the present time. So that's good news because, again, before most of the psychologists were working under the government of the Virgin Islands umbrella,
Mm-hmm.
but those who were working independently and not under the government's umbrella, you didn't know. You just based upon their presentation, whether they had the skills or had the certification to be out there practicing, and no one had really a good means to challenge their ability to provide those services. So that's good news, that making sure that you're getting a
Right.
therapist who's actually been trained as a therapist
Right.
and not just, holding themselves out as therapists.
Right. That's for sure. Don't they also administer exams? Or uh, I'm not sure if that's the case. Kind of like a bar association. Do they administer, to your knowledge, examinations
I
or?
do not know.
Okay.
I just had, over the years, had questioned a couple of folks as to
Mm-hmm.
their ability to advertise as a psychologist, but I
Mm,
never know of any certification
right.
nor exam that they had to. Well, now it may take that. It may require something more than just presentation of a transcript.
Right. I think I'd feel more comfortable if somebody did more than present a transcript,
But essentially, now there's some sort of governing board to assure the public that the persons have the skills and the necessary information to assist them
Mm-hmm.
with their troubles. All of our troubles, lots of trauma.
Absolutely.
Superior.
Absolutely. Absolutely.
So it's good to see that it's been thought of, it's been proposed before, and now it's in place. And actual oversight board is becoming operational.
Gotcha. No, this is great. This is excellent news for us. And now we're going to talk about the ADA, which stands for the Americans with Disabilities Act. And this is a law that Archie and I have gone way back in advocating for its effectiveness here in the U.S. Virgin Islands. Let's talk at least just generally how the ADA is broken up, right? Title I, employment. Title II, state and local government, possible discrimination. Title III, public accommodations. And Title IV covers telecommunications. I don't know, Archie, if you want to spend a minute at least talking about our set the Wayback Machine to 1997. when the Disability Rights Center waged an 8-week litigation campaign. What's your take?
Yeah, those were the days. Very exciting times.
Yes.
Yeah, there was a lively group of individuals who were varying degrees of disabilities,
Mm-hmm.
took it upon themselves to. I think we developed a format to check the hotels, go into various businesses,
Yes.
check to see if those are accessible, and they cared for it. I think it was 27
Yep.
lawsuits were filed
Yep.
at that time, and essentially working with they picked a industry, say a store, a regular retail store,
Mhm.
drugstores were addressed. The banks, I think we hit every bank
Mm-hmm.
to make sure that they were accessible.
Right.
Essentially, at that time, you had a still dial-up telephone company.
Right.
You're not. We go way back, way back,
Way back is right.
and essentially, also some employers. I think we only thing we probably tapped was the addressing the government at that time.
Mm-hmm.
But it still has its effect today because every once in a while we also did the hotels. So every once in a while, as you remember, we had people come in who wanted some issues with hotels to be addressed, and we still get some of that, not as much as before 1999. But we got a lot of different businesses to perk up there and pay attention. We did a lot of training behind that. That was sort of the impetus also for us to partner with the Northeast ADA out of Cornell on giving training sessions on the ADA.
Right. Right.
The other, which led to a lot of issues regarding service animals.
Right.
We found out by putting ourselves out there, we got inundated with a lot of service animals versus support animals questions.
Yeah.
And only to find out that across to me.
Yes, as you can imagine, because it became sadly a vehicle for people to say, well, I need to, and I'm just giving an extreme example just to perk you up. I want to bring my pet bull on the plane because he's my comfort animal, right? Well, no,
Right.
that's not what a service animal is under the Americans with Disabilities Act, correct?
Well, it was also confusing because the Air Carriers Act came out first,
Uh-huh.
and which allowed support animals on the plane. And I was always confused when I first when the ADA came out, and they only had a service. I was there when they gave a presentation at the National Disability Rights Network from the Department of Justice. They just said, "Oh, okay, they can have two animals. They're going to have a canine or a small pony." Of course, they had to explain to me why a small pony. Then after I heard because of rural areas, the terrain, and the issues with them having trucks that and the animals could be transported. But they didn't really give any parameters with regard to a canine.
Mm-hmm.
So then it came down to, okay, well, I had to wait for the Department of Justice to come out with some rules and regulations guidance. And so they said, well, you can't challenge them other than asking if the person has a disability and does this animal perform a task?
Right.
Because a service animal is supposed to be an extension of the person who has the animal for whatever task that they needed to be for in the public. One of our, I can't remember the gentleman's name. One of the persons on your task force was a veteran that had CNI dog. And if you've been around CNI dogs and or others truly trained service animals, they blend into the background.
Right.
They don't. They have to be under the control of the owner. They can't be aggressive. They don't even bark.
Right. And you
So
shouldn't pet them
I've been in.
because they have a
No,
task. They're working.
yeah, they're on the job.
Right.
So it shouldn't be approachable, and the person would let you know and say, "Oh, well, this is my service animal,"
Mm-hmm.
and that's the cue to person that the dog is on cue and it's on doing their job, and they're there for the person that has, a harness
Mm-hmm. Yes.
or under a leash. They
Right.
have to be under control of the person with a disability.
Right.
So I mean, I've been in too many airports where somebody comes up with two or three dogs and say, "Oh, well, these are my service dogs."
Yeah. Wrong. Yeah. Not
Or you got a smart aleck niece who brings to a little pocket dog to a restaurant and say, "Well, this is my service animal."
uh-huh.
So, so people were trying to sneak them in all kind of different ways. Also, the other law was the Fair Housing Act, which since the 60s had developed its own mechanism with regard to basically their pets. What they call them assistance animals, those emotional support animals, but they're not service animals. They do nothing other as a task than calm down the person or as a company or companion for the person. But they don't really serve as a task. We really are trying to always keep that service animal, maybe a psychological animal. The person may be having a seizure. They
Mm-hmm.
have trained dogs who have owners that may have a seizure to nudge that person, and they may get in position because I know they're got a position to make it clear, like up at their back against the wall. They have the seizure to slide to the wall down to the floor so they won't fall.
Mm-hmm.
And then a person may have a seizure that's non-intrusive, and they'll get back up and go about their business.
So
So there's dogs that have little packs on them. If a person needs to take their medicine, the dog will come up. It's got like a little fanny pack on its neck, and they
mm-hmm.
will take their medication. So they can train the dog to do various aspects, and that's why they picked out canines. What was happening for a while there, support animals, some people brought turkeys, rabbits,
Right. It
and
just
tried
got
to get them on the
yeah.
plane.
Yeah.
And it took a while before the airlines changed their position and started requiring that what I knew it to be said she wanted an animal, you could either put them in, they travel with you, had to either put them in cargo or they had to sit on each position in a cage under the seat of the Europe in order to see them on the plane. So there was no coordination. The airlines did what the fair housing under Fair Housing and Housing Act and condominiums, they were doing something else. And then ADA came in 1992, effective with the Service Act.
Okay.
But it took going to a conference to get all three laws on the table, and some coordination
And to
amongst
distinguish.
the various laws. Yeah,
Right. No, understandable. Okay. So service animals per se, as it relates to the ADA, applies to arguably a canine, right? Or a horse,
right.
or small point, but we'll just say canines because that's more readily available, I think, that performs a specific function for the person, right? And it's not a canine that you would even approach to pet or anything like that. This dog is working for his custodian, either getting that person, through the streets or their apartment, or I guess administering assistance with medications or assistance if an individual is having a seizure. That is a service animal, to be distinguished from a pet for emotional support, right? Now, the emotional support, that's not an Americans with Disabilities Act application. So are you suggesting, Archie, that an emotional support animal would fall under fair housing?
Yes,
Okay.
that's where it was developed.
Okay.
It was under the Fair Housing Act, and of course, a lot of people have pets. I've had pets,
Mm-hmm.
and you become very attached to them, almost like your children. I had
Right.
a pet from law school until I got to the Virgin Islands
Mm-hmm.
over a 15-year period.
Mm-hmm.
So you become attached, and they're like family.
Mm-hmm.
So, and although I didn't, I think I only took one vacation with my cat, but uh, there's families that want to make sure that they go with them wherever they go.
Right.
And that under that law, that's amenable, but
Mm-hmm.
doesn't work with on airlines. You have to check with each of your airlines. Most of them are developing accommodation and reservation lines. So you make sure if you're traveling with your animals or animal
Mm-hmm.
service animal, make sure the airline knows about it. And do not try to work that out at the gate,
Right.
service gate.
Right.
Got to be a ticket counter before you get on the plane, before you get to the TSA line.
Right.
Otherwise, you may end up in an argument and miss your flight.
Right. One of the things that we also had tried to, advocate for an improvements on is at our local airports. Has there been any updates to your knowledge with regard to that? Access to the aircraft and, whatnot?
No. The only thing we had was some pronouncements
Mm-hmm.
that I guess it was a turnkey project, another outside contractor was going to be in place. And we were always asking for bridges
Right.
to go. So we don't have to go in the tarmac. Don't have to worry about going up and down the steps. Don't have to worry about a truck or another assistance vehicle taking someone up to the entrance of the plane via lift, jet bridges. And I thought I saw, I don't have it before me now, but I thought at one point in time they had one rendering of the proposed airports with a jet bridge.
Right.
But other than that, we ran into that problem, I think, back in 2000 with American Eagle. That's the only one we were able to get a court action because they were following to the Air Carriers Act provisions as to boarding of persons with disability.
Gotcha.
And there was, at a point in time, there were ramps. JetBlue brought its own ramp, or they had lift trucks, same trucks that they used to lift, basically transport the food catered
Yeah.
onto the plane.
Right.
And they
That's
would
not a
use the other
solution.
side, the other entrance.
Right.
Person would go up by the lift and be able to enter the plane. Now, once they're inside the plane, they couldn't use their own wheelchair. So most planes had one that fit down the aisle.
Mm-hmm.
Because the aisle's too
Very narrow.
small.
Right.
Yeah, very narrow. So that was one thing that, or they could made some arrangements so their first suits the first class, so that the persons don't have to travel far on their own.
All right. So that's still a work in progress for sure. That is still a work in progress. So, Archie, we only have 2 minutes left. What should our community do if they have any questions or concerns with respect to the ABLE Act or the Americans with Disabilities Act or mental health advocacy? What do you suggest they do?
Okay. Well, we have several avenues. One, DRCVI has a website. So go to the DRCVI website, look up under resources. We have a lot of information on our website that you can follow all of our topics. The other aspect is if you're still unclear, you can call into the office at 772-1200 for St. Croix at 776-4303 for St. Thomas. And we can do an online conference with a question, or you can email us at info at drcvi.org, and we can email you back with information or arrange for a conference call if
That
it's
would work.
more in-depth information or customized information that you need.
Thank you
So those
so
are
much. Yeah,
Yep.
no, that's great. I am getting the signal that we need to wrap up, but I want to thank you for taking the time. I'd like to thank our listening audience, and hopefully you've learned a lot. Folks, take care, and thank you so much for listening. Bye-bye.
The views expressed on this program are not necessarily those of WTJX, its board, staff, or underwriters.